We had this beautiful lady come in to Korsmiles. One of the things that she was experiencing was definitely a lot of breakdown. She was grinding away at her teeth that were starting to get flat. There was a color issue, there was a TMJ jaw issue, chipped teeth, she had worn down teeth, she had clicking, jaw pain, she had a vertical dimension that had been lost, the height between your nose and your chin. So over time, if you're grinding your teeth away, then everything is kind of moving this way. Your nose and your chin get closer and closer together. She could see it through my technology that we have here at the office, where we can compare the progression over 2 years, 4 years, 5 years, 6 years. As we age, and everybody somewhat knows this, that you get these little wrinkles around the mouth area. Those wrinkles a lot of times have to do with your loss of VDO. All of those were addressed by doing 10 veneers on the top and 6 veneers on the bottom. We started with getting all of her records, which included the JVA, which is a joint vibration analysis. We use that to allow us to evaluate every bite that we do to make sure that it is a healthy position for the jaw joint. And we send this off along with many pictures and the x-rays to the lab. And then the lab and I design what the smile should look like aesthetically, that's going to fix all of the things that we want to achieve. The lab and I work very closely, and I kind of give them the design that we want and also what the patient wants. So the patient has a lot of involvement in this. She decided to allow me to be the person who is the driving factor of what kind of smile that she wanted. Most often patients do that. They trust me to make the design, but in the end, that design is put in their mouth before the final product is done. We start with an overlay, and the overlay is something that we put over your natural teeth before we do anything, just to see if the new bite is going to work with the jaw joint and to verify the jaw joint is in the correct position. And usually that is put in their mouth for a couple of weeks or sometimes longer. And this allows us to be able to know for sure that what we're working on and what we're pre-planning is going to be a straightforward, perfect situation. And then she came back and then we put her finals in. It took about a good month and a half for her based on what we were achieving. Now, not everybody's gonna be the same. Some people just want a nice smile. They have no problems with their jaw joint. They have no problems with wear on their teeth, and they have no issues with headaches and pain associated with it. But for her, we had to slow it down. Once it comes back from the lab, we cement everything. We usually like to take a picture or a video of the patient revealing their smile for the first time in front of a mirror, which is always exciting for me because they get to see what their new smile looks like. After we've cemented and they go home, we always have them come back about a week later to do what's called a bite check. We use a T-scan, and this T-scan actually shows what kind of forces that they're putting on their teeth in all areas. So I dial in the bite to make sure that everything is healthy and solid and that the bite is even and that the function is really good. And that day we also take our final glamour shots for the patient, and even if it's just a professional photo for work, if they need it, it's included, and we love being able to do that for patients. After all of that, we have to think about nightwear, especially for this particular patient. Nightwear is very important because the jaw joint is not necessarily always going to be in the most healthy position. If there's been damage already, then I can't take away that damage without surgery. So in the end, she will be wearing what's called a splint that allows to reduce clenching and grinding, reduce the muscle activity by about 80%, and it allows her to comfortably wear it at night so that she doesn't have any symptoms during the day. At this point, it's been a few months or more, and she has not experienced any headaches, jaw pain, and her bite is feeling great, and she's really happy with her smile, and that's all we can ask for.